So my practice is largely a degenerative spine practice. I only treat spinal conditions. We treat conditions in the cervical spine, the lumbar spine, and the sacroiliac joint. The SI joint has become a larger part of my practice over time. Lower back pain is one of the things that we've traditionally not been all that effective at treating with surgical intervention, and we've shied away from that for quite some time. It turns out that a pretty sizable subset of those patients had sacroiliac pathology, and it went undiagnosed for quite some time. So I'd say about 20 to 25% of patients that I see with chronic low back pain have sacroiliac pathology, and it just took a while to diagnose. So the sacroiliac joint is supported by ligaments, which are some of the strongest in the body, and for most patients it doesn't move all of that much. The exception is during pregnancy and in patients who have instability, and those folks are typically symptomatic. So people develop laxity of the ligaments that support the SI joint, and that hypermobility of the joint causes symptoms. The reason it's so symptomatic is this is basically the connection between the spine and the pelvis, and so hypermobility of that joint tends to cause quite a bit of pain. Yeah, so most people do fine with conservative treatments. That's kind of standard of care. We send people through physical therapy. Sometimes we treat people with SI lock belts. Injections are a very effective treatment as well, should those other treatments fail. It's a minority of patients that end up undergoing surgical intervention, and in those patients that fail, surgery works very well, but most people do fine with conservative treatments. In those folks that fail conservative treatments, there are now good surgical options which provide long-standing and permanent relief. So I use the iFuse procedure, and I've done so for the last several years in my practice, and it's been highly effective. The iFuse procedure involves about an inch incision. It's all percutaneous. There's minimal muscular damage, and patients do very well. I've been thrilled with how patients do. We're able to get them back to their normal activities and athletics much quicker with a less invasive procedure, and importantly, we have a good solution for a problem that we couldn't treat effectively before. So I've been happy with how patients have performed with this surgery, and it will be a large part of my practice going forward.